Hello viewers, my name is Dr. Pankaj Jariwala. I am an interventional cardiologist and pulmonary hypertension specialist and heart failure specialist. I am going to talk today about pulmonary arterial hypertension. Pulmonary hypertension means elevation of blood pressure inside the arteries which supplies the lung. And usually there are many causes are there, and basically there are 5 different types of groups of pulmonary arterial hypertension. And this kind of pulmonary artery hypertension happens because of the narrowing of the blood vessels which supplies the lungs, or there can be blockages in the blood vessels, or there can be destructions of the blood vessels. So there are various diseases are there. And this condition exactly many of the times is not known why it happens. What we call it as idiopathic pulmonary arterial hypertension, and as such this pulmonary arterial hypertension, exact how many people are getting affected in our country is not known. But in United States and in European country, it is almost like 10 persons per million population this disease affects them. And in India, we do not have exact statistics available. But once this disease is diagnosed within 2 to 3 years, the patient, they have a very downfall, and many of them within 5 years, almost 50 to 60% people, they die suddenly. And usually the symptoms in these patients are basically may have breathlessness while walking, they can have sudden fainting, loss of consciousness, or they can have chest pain or palpitations. Sometimes when patient disease is not recognized, the right side of the heart fails, and there can be a swelling of the lower limbs of the body, and what we call it as a heart failure. So there can be various presentations, but the good thing is that people should not be worried about it, and they should diagnose it immediately. And there are various medications are available these days. Before, the problem is in this pulmonary arterial hypertension, there is no much medicines were available, but nowadays we have specific medicines are available. And because of medications, if we start them early, diagnose them early, patients can have benefit, and early diagnosis is the key. And whenever doctor says that medicines to be given, it has to be given. There is definitely a role of vaccine also is there, because these patients, they are prone for various lung infections. So like influenza vaccine and other vaccines, if we give, then chances of recurrent infection is avoided. And the diagnosis is very simple. You just suspect it. That is the job of a cardiologist. And we subject them for a simple echocardiography. That is a 2D echo, what we call it as. So ECG, 2D echo, chest X-ray, CT scan, lungs CT scan, all these tests we do, and we make the diagnosis that patient is suffering with the pulmonary arterial hypertension. And once the diagnosis is made, we need to find out what is the etiology of pulmonary arterial hypertension. As I said in the beginning, there are 5 different groups of pulmonary arterial hypertensions are there. So we try to keep the patient in one of the group which he belongs, and depending upon the treatment varies. And usually the group 1 pulmonary arterial hypertension, the treatment is through the medications, and usually patient, they do very well on the medications. We have triple drugs available in the market now, and when we give 3 drugs to the patient, particularly in those who are high risk candidates, they do very well, and their life becomes without much problem. And they have to come to the physicians on regular basis. Checkups has to be done, and if they follow the regime what we have given to the patient, they do very well. So I think pulmonary hypertension is not the hopeless disease nowadays. It is quite a hopeful problem, and consult your doctor for your early diagnosis and treatment. Thank you very much.